Facilitating up to 1,920 puncture channels per second into the skin, your DP4 now opens up new opportunities for the combination therapy of mechanical regenerative medicine, DP4, but now the placement of active ingredients, solutions, and substances into the skin. This now becomes the ultimate synergy and combination therapies of mechanical but chemical rejuvenation, where we can now bypass donor dependency based on age, lifestyle, and diet to now promote a procedure that effortlessly delivers treatment and procedural actives into the skin to directly treat and target any indication, multiple indications for every patient, every treatment, every time. Ever since the creation of microneedling in the mid-1990s, there's always been the wish, the hope, the desire that maybe you could also use this to put something into the skin. As such, here is the evidence. So, under normal circumstances, we understand that you can't just apply a topical product and miraculously it's going to absorb into the lower layers of the skin. Why doesn't this happen? The reason why this doesn't happen is due to the skin's barrier function. Barrier function is a water in oil emulsion. How does this work? Barrier function waterproofs the skin. Imagine if a duck didn't have barrier function as it's swimming around in a pond. It's going to take on water and it's going to sink. Likewise, also the role of barrier function not only waterproofs the skin, but also serves as your acid mantle to maintain balance of biome, but to also prevent transepidermal water loss. As a water in oil emulsion, this works through your lipid phase. Your lipid phase is characterized by sebum, 57% triglycerides, 25% wax esters, 15% squalene, 2% cholesterol esters, 1% cholesterol. And what is also produced in your sebaceous gland is vitamin E and coenzyme Q10. What we see produced in granulosum epidermis is what is called a lamellar granule. Lamellar granules, in this instance, are responsible for the release of ceramides, but also free fatty acids. And these will occur in granulosum epidermis. The other term for a lamellar granule is also called a keratinosome. So we have keratinocytes and keratinosomes. For your lipid phase of barrier function, sebum, 57% triglycerides, 25% wax esters, 15% squalene, 2% cholesterol esters, 1% cholesterol, plus vitamin E, plus the release and the byproduct of lamellar granules, ceramides and free fatty acids, equals your lipid phase. Let's talk kitchen. If you blend in olive oil and balsamic vinegar, water and oil, the two don't mix. So we understand that you need to emulsify to create a water in oil emulsion. The emulsifier in this case for your body is the 2% cholesterol esters and 1% cholesterol. The other consideration that we have is natural moisture factor. Natural moisture factor refers to your water potential within the skin. However, interestingly enough, natural moisture factor is not water. So I describe this not too dissimilar to jelly crystals. Jelly crystals will not turn into jelly until you add water. So natural moisture factor, or NMF, contains around about 40 to 42% of free amino acids. Cysteine, lysine, proline, alanine, tyrosine, so on and so forth. If you consider a Lego building block, this is a lot like an amino acid. If you build a structure that is 50 or less Lego building blocks, this is what we call a peptide. If you create a structure that's 50 or more chains of Lego building blocks, this is what we call a protein. So when peptides, collagen, elastin, keratin, begin to degrade, they form their free individual amino acids, which serve as potent water binders, like cherry flavor jelly crystals. We also take into account that there's orange flavor jelly crystals. And in this is around about 18% inorganic salts and sugars. I liken these to the electrolytes that you have in an electrolyte drink. So the most common areas of consideration for this, of course, are going to be sodium, magnesium, and also calcium and potassium. In natural moisture factor, we also see the role of hyaluronic acid. Hyaluronic acid becomes activated through the addition of water to bind its own weight about 1,000 times. From hyaluronic acid, we then look at around about 12% of glycerin. We then move into lactic acid. So the reason why lactic acid is the most hydrating of all alpha hydroxy acids is because naturally it forms part of your natural moisture factor. We have a look at ingredients known as PCAs or pyroglutamic acids. The most common one that you would see is zinc or sodium PCA. And then we move finally into the role of urea and urocanic acid. As such, we have cherry flavor jelly crystals, orange flavor jelly crystals, passion fruit, port wine, mango, lemon, lime, and tutti frutti. So with this, I want to show here that each of these agents will bind, draw, and hold onto water. Then as part of the emulsification process, as they act and as they then produce and stimulate through water, the cholesterol esters and cholesterol will then emulsify them into your oil phase, and this creates your barrier function, a water in oil emulsion. With this barrier function, depending on your Fitzpatrick skin type, this will sit as an acid mantle, which will sit pH 4.5 to around about 6.5. So it ranges depending on your background. So what I want to show here with a very long explanation, that barrier function prevents your skin from absorbing topical ingredients under normal circumstances. So since the development of mesotherapy, 1957 in Paris, France, by Dr. Michel Pistor, the syringe has reigned supreme in medical aesthetics. And the syringe is still believed by many practitioners to be the quickest, most efficient way to administer a procedural active, ingredient, drug, or agent into the skin. Let's consider. Look at the second biopsy. This shows an intradermal injection of a solution using nappage or point-by-point technique. So you can see where needle goes in, plunger is pushed, solution is released, creating this small green bolus. As such, if you compare this, however, to biopsy number 3, this is DP4 technology. So although the needles are not hollow like an injection, mathematically, with nappage or point-by-point injection, you're probably only getting one hole, one needle per 3 seconds. Use a mesotherapy gun, you might get 7 needles or holes every 3 seconds. So as such, at 120 revolutions per second, we now facilitate an unprecedented 1,920 holes per second. So the critics would say, hold on, my injection reigns supreme because your needles are solid and my needles are hollow. No, they don't. The physics and the mechanics of 16 33 gauge needles at 120 revolutions per second physically forces and distributes that solution into the skin. You have a 90-degree angle of entry. The critics will say, well, hold on, with microneedling, the solution might come out. Probably with a roller, the needles will penetrate at a 90-degree angle, but some 75% of your revolution are the needles paddle steaming or cutting and arcing through the skin. Then you'll hear other critics say, well, blood's going to push the solution out. You're not drawing blood when you create an injection for mesotherapy, for PRP, for administration of actives into the skin. Again, nearly 2,000 puncture channels per second now facilitates with evidence and better capability by comparison to traditional nappage or point-by-point technique. So this now opens up new opportunities for administration of a chemical agent. So we now promote not just mechanical regenerative medicine with DP4, but also chemical regenerative medicine with your DP Dermaceuticals MG collection. This allows for you to reduce donor dependency, particularly based on weight, based on age, based on diet, lifestyle factors. We can now overcome to some degree, and especially with exosome technology, where patients do not fit the right criteria for a correct and youthful regenerative response. On the other hand, with all of these puncture channels, we open up new opportunity for the infusion of injection-free PRP, for the infusion of nano-fat, but even for drug infusion and innovative treatment with reconstituted botulinum toxin, delivering a mesotox procedure that is administered via a DP4, not with injections. So new opportunity. However, as early as 2014, Sultani Arabshahi, at this point a New York practicing dermatologist, identified that just because you have a prescription pad, just because you have an affinity with prescription ingredients, doesn't mean that you can just take any of these products and then start microneedling them into the skin. Sultani Arabshahi proves that just because you can doesn't mean that you should. As such, in one of her studies, infusing into the skin a topical designed vitamin C and topical anti-aging products, 70% of the patients following just one microneedling procedure showed signs of granulomatosis reactivity. So a granuloma is when you have a physical foreign body that's stuck in the skin. Can't go up, can't go down, can't go sideways. It becomes a risk for infection, and it also becomes a risk for further scar tissue. With this, these are three of Sultani Arabshahi's patients from her clinical. Patient A and patient C were placed on long-term oral doxycycline for 6 months following one procedure. So whilst on one hand, Sultani Arabshahi acknowledges that the needles will create an effective and superior transdermal delivery, on the other hand, she also states just because you can doesn't mean that you should.